Hello everyone and welcome to a new episode of DocuSync. My name is Obeso. I'm thoracic surgeon here at Cleveland Clinic, Abu Dhabi. Today we are diving into a topic that is critically important in the field of medicine and public health, lung cancer. Lung cancer remains the leading cause of cancer-related death worldwide, causing more deaths than each year than breast, colon and prostate cancer combined. While the incidence of lung cancer in UAE is somewhat lower compared to other regions, we cannot underestimate its impact. Early diagnosis, multidisciplinary care, and access to advanced treatments are key to improving outcomes. To help us better understand the landscape of lung cancer, its challenges, treatment options, and the importance of early detection, today, in this new episode of DocuSync in Cleveland Clinic Abu Dhabi, we have the honor to have two big experts in the lung cancer field. On my left, we have Dr. Dean Park.
Hello, I'm one of the medical oncologists here at Cleveland Clinic Abu Dhabi. I see patients with lung cancers as well as other solid tumors.
And on my right, we have Dr. Ali Wahla.
Hi, my name is Ali. I'm one of the pulmonologists, and I work with my oncology and thoracic surgery colleagues in the diagnosis and management of lung cancer.
Okay, so let's start with the first segment of this DocuSync podcast. We are going to try to understand the lung cancer and possible risk factors. So I have a question for Dr. Dean Park. Dean, please, can you explain us in simple terms what lung cancer means?
Sure, Andres. The way I like to explain it to my patients is just to start with some very basic definitions. So as I'm sure we all know, the human body is made up of different organs, and in each organ you have cells. And each cell in the body is programmed and supposed to do certain specific things. Cancer happens when the cells become abnormal. They're no longer functioning the way they're supposed to. And in addition, they grow abnormally and they spread abnormally and they can invade other parts of the body. That's what makes it a cancer. Lung cancer is what doctors call it when the cancer starts in the lungs. So we know that some tumors can start in other parts of the body and spread to the lung, but today we're focusing on lung cancers, which are cancers that start in the lung tissues themselves.
That's a great definition, Dean. So let's continue with talking about risk factors. Dr. Ali, what are the main risk factors for developing lung cancer, and how common is smoking compared with other factors?
Thank you, Andres. So far and away, the most common risk factor and the most important risk factor is exposure to tobacco products. Now, in the West, as predicted, there's usually been smoking in the form of cigarettes. But here in the UAE, it's not only cigarettes, but also exposure to other tobacco products like midwach, shisha, doha. So all of those things are very important risk factors. There are also other risk factors like asbestos exposure, radon exposure. But in our context, the most important thing is tobacco products.
Okay, that was, I think, that the message that we should give to the audience is also the quit smoking, right? So we have
Absolutely.
a program here in CCAD about quit smoking.
Yes, absolutely. I think smoking cessation and quitting smoking is the most important thing anyone can do to lower their risk of cancer.
Okay, perfect. And Dr. Dean, regarding genetics, how does genetics or family history play a role in lung cancer risk?
So as I'm sure we all know, there are definitely some cancers that tend to run in families, and sometimes that is because of inherited genetic changes that put patients at a higher risk for developing certain cancers. For example, we see this fairly commonly with breast and ovarian cancers. We do not, however, see these inherited genetic changes generally predisposing patients to developing lung cancers. When we do see patients in the same family all having lung cancer, it's more commonly because there are multiple family members who are smokers who have other environmental exposures.
Great. And let's talk a little bit also about symptoms. Dr. Dean, what are the typical symptoms that the patient might notice related to lung cancer?
Unfortunately, many patients do not develop symptoms, in other words, problems due to their lung cancer until it's quite advanced. Sometimes we'll see patients with a cough, coughing up blood, shortness of breath, unexpected weight loss.
Great. And Dr. Ali, we know that most of the patients, especially in early stages, the symptoms are completely silent, right? So
Right.
unless the patient has advanced lung cancer, which can create some symptoms, but usually in early stages, most of the patients has no symptoms. So how can we detect this lung cancer? How can we do the diagnosis?
Yeah, so that's a very good question. So because of the fact that patients usually develop symptoms later on in their stages, historically, that has meant that when we would diagnose patients, we would diagnose them in the latest stage of lung cancer. Lung cancer is divided into 4 stages, and stage 1, 2, 3, and 4. And 3 and 4 really have poor outcomes, especially 4. But 1 and 2 have very good outcomes if they can be caught earlier on. But these are the patients who usually don't have symptoms. So that led to the idea of doing low-dose CT scans in patients who are at risk to try and develop these, to try and diagnose these cancers earlier on. And because of that, what we found is that we are having something called stage shift. We're actually diagnosing cancers at an earlier stage when the patient may not have any symptoms, but at that stage, we're able to completely cure his cancer.
Exactly, absolutely. And can you tell a little bit about the screening program here in Cleveland Clinic Abu Dhabi? This screening program is for everybody or just for selected patients?
Yeah, so our program is in partnership with the Department of Health, and currently the program covers those patients who have smoked for more than 30 pack years of cigarettes. And what that means is that they're smoking 1 packet of cigarette per day for 30 years. So if somebody is smoking 2 packets of cigarettes for 15 years, that still qualifies as 30 pack years. So they've smoked that amount or 20 years worth of shisha or doha or midwach. And they are over the age of 55. This includes current smokers as well as former smokers who have quit within the last 15 years.
Absolutely. And we can say that the screening program for lung cancer saves lives?
Absolutely. So there is actually a lot of data, not only from the US, but from Europe and now increasingly all over the world, that shows that since you're diagnosing these patients earlier, you're actually curing their cancer. So in the past, they would have been diagnosed at a later stage and they would have probably died from their lung cancer. Now they're being diagnosed at an earlier stage, going for surgery or going for therapy and being cured of their cancer.
Great. Let's talk a little bit now about the diagnostic tools that we have for the diagnosis of lung cancer. So what diagnostic techniques are commonly used to detect lung cancer? And could you explain how procedures like imaging or biopsies work?
Sure. So let's take a patient who's, say, part of our screening program. So he gets a low-dose CT scan at a time when he has no symptoms. He has no cough, no fevers, no hemoptysis, no coughing up of blood. And we find a lung mass or a lung nodule. Now, we can diagnose this through different ways. If this is a lung mass, we can actually do something called a bronchoscopy, which is a tube that we place through the airway into the lungs. It's usually done with patients under sedation. And then we can take a biopsy that way. The other way is through a needle from outside. And this is also done under CT guidance. So that we are able to get into the mass and take a diagnosis. On rare occasions, if we feel that the patient is very high risk of cancer, we may go directly to surgery and also remove the tumor.
Exactly. And Dr. Dim, once we get the diagnosis of lung cancer, how can we do a proper staging of the disease? And how important is to do a proper staging in lung cancer patients?
Yeah, Ali's already mentioned the idea of staging. I often tell patients staging just refers to figuring out how much cancer is there and where exactly is it in the body. We do staging oftentimes by doing PET scans of the body to see if there's any signs of the cancer spread outside the lungs. Sometimes we'll do a brain MRI to look for any signs of cancer in the brain. Sometimes we'll have to do additional biopsies, especially of lymph nodes in the chest, to see if there's any sign of spread. And the reason we do staging in the first place is because by understanding how much cancer there is and where is it in the body, that helps us determine the best treatment options to hopefully eliminate the disease completely, or if not eliminate it, control it as best we can.
And do we have all the facilities here at Cleveland Clinic Abu Dhabi?
Absolutely. We have PET scans, MRIs, everything we need for staging is readily available here at Cleveland Clinic Abu Dhabi.
Great. So, talking about the staging, we can classify the patients in early stage or advanced stage, right? Mm-hmm. So let's move to how to treat these patients. Usually, as a thoracic surgeon, we are basically treating patients with early stage lung cancer, right? So we can offer to these patients surgical options. So usually the gold standard in lung cancer surgery is to do a lobectomy. Lobectomy, in simple terms, just means to remove one of the lobes in the lung. This is the gold standard. Sometimes we can do more complex surgeries as cementectomies or more aggressive as pneumonectomies. And the surgical approach for these patients has substantially changed in the last decades. I remember when I started my residency, most of these patients we approach doing a thoracotomy. Thoracotomy means to do just a large incision in the chest, split the ribs, so which is tremendously painful for the patient in the postoperative course. During the last decade, we start to do minimal invasive approaches, BATS, which means video-assisted thoracic surgery, or using robotic platforms. This minimal invasive approach means that we only do small incisions in the chest, so the recovery of the patient after the surgery is much faster, and the patient can be discharged earlier. So this is critically important when we are talking about surgical procedures in lung cancer patients. But let's talk a little bit, Dr. Park, what to do with these patients in advanced stage. Which treatments we are available, and how we can manage these kind of complex cases.
So when we talk about advanced stage disease, these are unfortunately patients for whom surgery is not readily available as an option because there's too much disease in the wrong places. Sometimes we can still consider radiation treatments, but for the most part, we're talking about systemic therapy. Systemic therapy is just meaning drugs that go through the bloodstream and that go everywhere the blood goes, so covering the whole body. Nowadays, systemic therapies can include traditional chemotherapies, drugs that kill cancer cells directly. We also have immune therapies, which are drugs that stimulate the body's own immune system to fight off tumor cells. And we also have targeted therapies. Some cancers, unfortunately not all of them, but many of them do have specific alterations or changes in the tumor cells that we can target with specific medications.
So we can say that nowadays the treatment of lung cancer patients are completely personalized.
Yes, as you've already alluded to, changes have happened. There have been many changes since we were in training many years ago, and the advances are quite incredible in some cases.
Okay. Let's talk, Ali, about a critical point in the management of lung cancer patients. So how we decide the treatment of these patients in our multidisciplinary sessions?
Well, as you and Dean have pointed out, the last decade or decade and a half have been like a period of immense scientific discovery when it comes to lung cancer. We're starting new therapies, immunotherapies, targeted therapies, and all of this has made cancer treatment more complex. And the cornerstone of managing cancer treatment is being in a cancer center that has the qualified pulmonologist, radiologist, radiation oncologists, surgeons, oncologists, and pathologists. So ideally, you'd want to come to a place which is a cancer center and where they're doing regular tumor board meetings. What a tumor board is a multidisciplinary meeting like what we have here. It happens once a week in which we discuss every lung cancer patient and try to personalize a treatment based upon that patient's specific needs and the specific treatment based upon his mutations or the results of his biopsy.
Absolutely. This is a critical point, right? So
Absolutely.
treat this kind of complex cases in a multidisciplinary environment. And I have a question also for Dr. Parra. In your opinion, what do you think is probably the most advanced change regarding the lung cancer treatment that happens during the last years?
So I've already mentioned both targeted therapy and immune therapy are both really, frankly, incredible advances in cancer treatment in the last 10 or so years. We virtually never saw patients with advanced lung cancer living for more than a few months or a few years. And now that is a much more common occurrence due to how effective some of these immune therapy and targeted therapy treatments can be.
Great, thank you so much. So just to finalize the podcast, Dr. Ali, Dr. Dean, I would like to ask you to send a final message to the audience related to lung cancer.
Sure. From my standpoint, I would like to talk to those people who are current smokers and may not have any symptoms. They need to realize that smoking is the biggest risk factor for lung cancer. So I would suggest they come to a smoking cessation clinic like we have here in Cleveland Clinic. And if they are candidates, we will also enroll them in our lung cancer screening program so that we can diagnose their lung cancer earlier on, where it can be treated with a cure rather than have to be managed at a later stage.
Dr. Dean?
I would like to say to those who've heard the words lung cancer and have had that diagnosis, I know that can be tremendously frightening, but I would just urge you, please seek out medical care. Don't let your fear dictate your actions and ignore it or be in denial, but please come to Cleveland Clinic Abu Dhabi or seek another qualified medical center where you can get appropriate, advanced, personalized treatment.
Thank you so much for these really important messages to the audience, and that brings us to the end of today's podcast. Lung cancer is a serious disease, but if we find it early, treatment can be more successful. That's why it's so important to know the possible signs, like a cough that doesn't go away even with blood, chest pain, shortness of breath, and to speak to a doctor if you notice anything unusual. Getting care at the right place also matters. At Cleveland Clinic Abu Dhabi, we have a full team of experts, advanced technology, and everything needed to give patients the best possible care. If you or someone close to you have symptoms or has been diagnosed with lung cancer, don't wait. Please reach out to us. We are here to help. Thank you for joining us today. Take care, and we will see you in the next episode.